Hi, my name is Ann Shelley. This is my husband, Chuck Shelley. And we came to Colorado about 4.5 years ago. Before we came to Colorado, I was a teacher in Washington State. I taught first grade. Every day I would move these tubs all around the classroom. And after a few weeks of that, I noticed that my back started hurting and I had a pretty bad cough. I went into the doctor for the cough, and as I was leaving, I just happened to mention, oh, by the way, I have this really bad backache. So he told me he was going to order a uterine ultrasound just to see if I had fibroids or, something going on like that. He said, looked at my scans and said, well, I would say I'm 90% sure it's not cancerous, but you need to have a hysterectomy. And I was in surgery, and the doctor came out to Chuck and to my parents, hanging his head, and said, well, we were wrong. It is ovarian cancer. And I always say, my life changed that day. So I was on chemo 3 weeks and off 1 week every month. I had a CT scan. Good news, you are cancer free. Those words were the best words I'd ever heard. I think I was only in remission about 3 months and got a backache. And I said, oh honey, I've got a backache again. And we're just thinking, okay, no, can't be. My oncologist, he did another scan. Cancer was back aggressively again. And he sent that scan to my gyn-onc, and she sent a message back to him and said, I'm sorry, she's beyond my abilities.
I was promoted and got transferred to Denver. They'd kind of exhausted everything in Washington State. There were no options.
I had a nurse that whispered in my ear at one point. She said, you need to go to a research hospital. And she gave me University of Colorado Hospital. I went and met with Dr. Guntupalli for the first time, and during those exams, he realized that I had a tumor growing on my rectum. And he was watching that tumor, and every week he told me it was bigger and bigger, and I needed to have surgery. There was no choice.
So Dr. Guntupalli came out first, and he goes, I think we can get it all. I can get all the tumors and add to her life. He goes, I think I might be able to get another year, but she'll lose part of her bladder, and obviously she'll lose her rectum, so she'll have to have a colonoscopy bag. And maybe another hour passed, and the nurse calls me and says, Dr. Higuchi wants to talk to you. So he comes out and he goes, well, there's more tumors on her bladder, and by the time I got cutting everything off there, it would be so little that she would be, having to go to the bathroom every 15 minutes or whatever. We can take it out, and she would be also what we call a double bagger. She would have a urostomy bag too. What would you like to do? And boy, how do you answer that? Excuse me. I just said, she's a fighter, and she'll find a way.
Wake up in the hospital, double bagger. I'm like, wow, and they made him change my bags in the hospital. I was like, no, I don't want him to see them. And they said, no, he has to know how to change your bags in case there's some time where you become incapacitated or you're sick and you can't do it yourself. So before I learned how to do it, Chuck learned how to do it.
Dr. Guntupalli has never avoided any conversation.
Even the hard sex conversations about, well, yeah, you really don't have a vagina, and are you comfortable talking to me about sex because, this is going to be a issue, this is going to be something for the two of you.
I didn't, obviously I fell in love with her. I loved the physical side of things, but that's not who I love. I love her, the soul and her spirit. There's still ways to, obviously excite each other and still have, I guess the same result, the intimacy piece.
My feeling is I really am hopeful that I can help other people. Maybe be comfortable. I'm learning to become more comfortable with having bags. I felt so bad that here I am, I am a woman with no vagina, can't really, have sex the way a normal person can, and nor can Chuck.
Early on, I don't think you do know how to handle it or work through it, and so you definitely just have to communicate.
Strong.
Yeah,
Super
I
strong
just had to
together.
reassure that our marriage was more than just sex, and it was more than the abs that she once had on her stomach and some of the physical things. It just wasn't. It was just different now. It hasn't all been peachy rosy, but the little spurts of times, the little times that we do get, I think are appreciated more, and I don't know, they just you make more of those moments, you really do.